Good evening, everybody, and welcome to the June 1st Monday Meetup. I see we have an exceptionally tiny group here today. In fact, I know each and every person on the call. Hopefully we'll have more people call in. This is a second part to the private practice call we had a few weeks ago. And so just a continuation of those discussions. I'd like to now ask Robin Scott, President of SAOT, to introduce our guests this evening.
Thanks, Robin. Hi, everyone, and welcome. Today on our call, we have Marian Baird joining us again today from ACOT. Carmen's going to hopefully be joining us later. So Marianne, I'll turn it over to you and just ask for any updates you might have or feedback you'd like to share with the group.
Yes, just one update from ACOT. Our new website will be going live this week. And if you've got links in the old website, just remember to check out the new site to update your links. The main site will remain the same, but the internal links will be changing.
Thank you. All right, so as Robin mentioned, we do have a small group today, but Christine and Dawn, thanks for joining in. If either of you have anything that is on your mind, updates from your communities that you'd like to share, I'll turn it over to you guys and open the floor.
Hi there, it's Dawn. Sorry, I was just sending out a text to a few people because I'm a bit surprised at this small group.
Thank you for doing that.
Yeah. So I guess for me, I started in-clinic functionals last week, and Chris can probably attest to it. It's quite the new experience to spend 8 hours wearing a mask.
It is. So aside from the mask, how has implementing the functionals been going?
Well, for me, not too bad. There was some pre-stuff, and I know Chris has a similar protocol because Sharon Kaskowski actually presented to the law group, ACTLA, last week. She was part of a panel of healthcare professionals just talking about how we were going to move forward with medical legal assessments. And yeah, just doing a pre-screen, having people be aware that they are going to be asked to, you know, be conscientious and respectful of kind of any guidance or things I needed them to do. And yeah, it was similar, but, you know, different. A lot of hand washing.
Yeah.
More so than before.
Yeah. And how about for you, Christine? How have things been?
Hi there. Sorry, right when we started, I spilled a full glass of water all over my desk and my computer. So,
oh no.
I've been trying to clean that up here desperately, hoping Dawn would just talk longer.
Oh, sorry. And then I was feeling bad about talking too much.
Well, you can't. Nobody's ever pleased, right? Anyway, I think I'm good. Nothing started on fire or sparked, so that's a good start, right?
Mm-hmm.
I started seeing people. We started on the 11th.
Oh, sorry, Christine. I think you cut out for a moment there.
Oh, okay. Let me just make sure I'm all plugged in. Is that better?
Yeah.
Yeah. Okay, good. Yeah, so we started seeing people on the 11th. So we've seen a fair number so far. And yes, Dawn's absolutely right. It's definitely different working with the mask on all day and gloves for part of the day. And I have the face shields as well. So we have similar, we call people when we're booking and go through the questionnaire, and then we go through it again. the night before when they come in, and then when they're greeted, they get disinfected. They get hand sanitizer and so forth, and their temperature is taken. And then we have them sign, as part of the consent form, we have them sign all those questions as to, contact and so forth. And I sign the same thing in front of them, saying that I've also, following those rules, and I haven't been exposed to my knowledge and so forth. So most people have been actually everybody has been really good about, subjecting to the rules and following through properly and so forth. I don't require the person to wear the mask the whole time, because for a good part of it, we can be far enough apart. And especially, I'm curious, Dawn, what you've been doing. My biggest concern is, I definitely have them wear it when I'm, approaching them, touching them, doing physical exam, that sort of thing. But I'm uncomfortable with them wearing it during cardiac testing and during lifting and carrying. What's your thoughts on that?
Yeah, and that's actually something I would like to hear from ACOT about. So my guy, I've only assessed one person in clinic for functional so far. He would have none of it. He wasn't going to wear a mask. He was very polite about it, very understanding about it. But yeah, he wasn't going to do it. And yeah, I don't think that would be necessarily a safe.
The results, right?
Yeah, to have them do it during cardiorespiratory testing and stuff, I think it would just be a big distraction. And you're right, there is a good chunk of that day where we can maintain that distance. So.
Yeah, so I've had a couple people who chose to wear it. Most people, they start off and then after a while they stop. But like you said, lots of hand washing. We're very careful about, maintaining the distance when able. And then when we do the physical exam, I do ask them to put it on.
Yeah. And what I did is I packaged up PPE into sandwich bags. I refer to them as the Halloween giveaway handout kits. And, just Lysol, a couple Lysol wipes, surgical masks, and gloves. So, yeah. Oh, that's interesting. With a vet who wouldn't wear a mask. Oh. Interesting.
You'd think they'd know better.
Yeah. Anyways, I see we've got some other people that have come on, so maybe people want to do an update for them.
Yay! Not just us.
Yeah, that would be okay.
The pressure's off.
The pressure's off.
So, Melissa, Joanna, and Alana, we're just doing kind of updates on how people are finding things at this time as things are beginning to reopen, how you're doing in your clinics, if there's any changes that you've made and how that's going.
Hello. I have not started doing face-to-face sessions and have only been still doing the telehealth so far. So I'm curious just to hear how people are managing it. I primarily work with preschoolers, but always with children, and the debate of whether or not it's worthwhile trying to work with them with masks and gloves or trying to keep 2 meters apart, or if staying with the online format might be better for the next little while at least.
Are there any other folks on the call that work with preschoolers currently? Or who have maybe done some of these assessments? Robin's just added a note in the chat box that currently you are likely muted, so you'll just need to go into the box to the side of participants and unmute your line, or to the top of your own screen.
I don't work with children, but it's my understanding that, is there a particular age? Because I've seen 2 and I've also seen 6 as an age when it's considered, not a good idea to put a mask on a child. Or are you referring to the mask and gloves on yourself? probably more likely.
Yeah, kind of both ways that, yeah, for a child to be wearing it, that is a tricky one. And I need to look into that a little bit more carefully. But even for myself, often if I'm working with children, especially those ones with autism spectrum disorder that have a lot of regulation concerns and things, trying to interact with them with a mask and with a lot of boundaries. There is that debate if I might be just as effective on the screen, where at least then I'm not trying to change things and I still look the same.
Hi.
Melissa, oh, go
You
ahead,
just
Joanna. Are you still there? Joanna, are you on the line? Melissa, I work in pediatrics as well, but from an inpatient setting. Although I do know a few folks in the community who are trying to do assessments. Certainly, I see the challenges there, and I experience them myself with our kiddos when they come in. I'm not sure if you have come across many social stories, but AHS within our pediatric group, we just shared a social story that's for kiddos with autism or Down syndrome about why we're wearing masks right now. If that would be helpful to you, I'd be happy to pass that along. Certainly, I think the challenge of trying to complete those assessments online would be difficult. I know a lot of families have found that time quite helpful to connect and easier in some ways to connect, but I'm not sure. I personally can't speak from experience as far as how those assessments online have been going.
And that's so true. And I'm not actually even doing standardized assessments at this point. This would be for actual treatment with children who are currently on my caseload, which makes it in some ways a little bit easier because they're already used to me and we're familiar. The assessments, I know there was some concerns about whether or not it would be standardized if it was over a screen. So we haven't taken that on yet.
Thank you, Marianne, for your comments there regarding what PPE to wear. Just to summarize in the chat box, if you all don't have it already open, you're expected to wear surgical procedural masks, not cloth or homemade masks, for all in-person delivery where the 2-meter physical distancing requirements cannot be maintained for the entire time that you're present with the client or their caregivers.
Hi, just further to your comment there, Marianne. So that makes sense, and that is what we're doing. So the additional PPA, the eye protection, and all that sort of thing depends. So that's more. So the wearing a procedural mask protects our client. Them wearing a mask will protect us, but we can't. So I'm trying to go in the ins and outs here. So the additional PPE, so when you say depends on the risks your clients pose to you, okay, so that also makes sense. If your clients are not able to wear a mask, then you select the PPA required based on a point of care risk assessment. Could you clarify that last sentence for us, please?
Yeah, so you would do a screening assessment to see if the client has any risk factors. And then you would, if the client isn't able to wear the PPE, then you may increase your own PPE if the client has any risk factors.
Okay, so basically, because from my understanding so far, we're not seeing anyone who has any risk factors, like we just won't see them, right? So there isn't, by the, by that word, it basically means that the client does not have to wear the PPE. because we're
It,
not seeing anyone that has any risk factors. But we can certainly wear more in order to protect us both if we wish, right?
yeah, and it's still recommended that the client wear the PPE. But if they refuse or are unable for some reason, then you are making a call, basically deciding if you still want to take the risk to see them, and if so, then perhaps protecting yourself further.
So the face shield. And I
Yeah.
wear gloves when I'm, if I'm touching them or touching anything that they're going to be touching. And, we go through a lot of hand sanitizers. So I think we're okay there. I just, want to make sure that I'm not putting anyone at unnecessary risk. But we're very, very careful with our screening and such as well.
Yeah, yeah. So it's the rule of thumb is still to encourage all clients to wear the PPE, and hopefully it's the exception rather than the rule when you've got refusals or inabilities to wear them.
Okay, no, that makes sense. Thank you.
Mm-hmm. I mean, to add to that, depending on your clinic, it's up to you whether you want to put a policy in place, depending on the risk factors you have in your own household, for example. And I don't mean risk factors for COVID. I mean risk factors if you have somebody yourself or somebody at home who has is diabetic or immunosuppressed or that kind of thing, then you're able to put in a clinic policy to say, sorry, we can't do the assessment with clients that aren't willing to wear PPE. That is up to your own policy.
Yeah, I understand that. That makes sense. And actually, that's kind of funny in Robin's comment about the vet. My vet isn't seeing people face to face because her husband is immunocompromised. So we've got to have virtual vet appointments. But but yeah, that makes sense. Home visits. I have done one or two, and I'm in and out as quick as I possibly can. We do everything else outside of that. But
Mhm.
basically, I'm not going to see anybody that there's even the slightest hint that there might be a problem in you know, any way, shape, or form. And, gloved and masked the entire time. Try not to
Yep.
touch anything. Don't touch the cats and dogs. Don't, ask them to turn lights on and off. And,
Mhm.
don't accept a glass of water or use the bathroom. And
Yep.
I'm wondering if and I have little booties to wear over our shoes as well. I wonder if
Mhm.
in that case a gown might be a good idea, or
It
that's
wouldn't hurt. It wouldn't
yeah,
hurt for sure. And um, being sure that you're screening not only the client, but anybody else that's in the
yeah,
home.
yeah, yeah. So far it's been people who lived alone, so that was easy. But
Mhm. The
I
way
think okay.
the way our director of policy and practice, Angela, puts it, she says, treat every home as if they have bed bugs, and then it gives you the idea of protection that you want. So, and what she's getting at is exactly what you described. So, not accepting a glass of water, getting them to turn the lights on and off, not touching anything, keeping the booties on over your shoes and those kinds of things. Those are all measures so that you're minimizing contact with any surfaces in the home.
Yeah, let's
Alana, if you're still on the line, how are things going for you? Let's see, Joanna's joined us back on the call. I'm not sure if she can hear us though. Robin's just let me know that Carmen is now joining us as well. So
Hi,
Carmen,
everyone.
thank you.
Hi,
Carmen,
everyone.
just as
You
an
can hear me
update,
okay?
yes. Oh, and looks like we're having some technical difficulties with unmuting. So the unmuting button should be at the top of your screen.
Ah, now it works.
Perfect.
I guess
So
one of the,
Carmen,
yep, go ahead.
go ahead, Dawn.
No, go ahead and
I was just
introduce
gonna.
Carmen.
Okay, so Carmen Lazarak is the provincial practice lead for Alberta Health Services occupational therapist. Carmen, so far today, what we've been going over is just kind of an update on how people are managing with returning to work, with new PPE precautions, what it's looking like as we're moving through stage 1 and moving into stage 2. Are there any updates you'd like to provide the group from AHS side?
Thank you, Robin. And hi, everyone. I don't have any specific updates, but why don't we just keep going through? I think, yeah, the updates that I have are not really specific to the topic that we've been talking about it to this point. So if anything comes up, I'll definitely let you know if I think of any updates to provide.
Thank you.
So it's Dawn again. I guess one of my things that I'm trying to balance right now is how to not make COVID-19 be a distraction to the assessment, just to do the assessment and to get it done. So I appreciate the additional information about the insistence on what people could be wearing for PPE. I guess my other thing is that there's been some debate within our group about that follow-up, people getting back to us if they have COVID-19 symptoms. Now, I'm not asking them to do that as much as to let me know if they or somebody close to them tests positive for COVID-19, because I don't know what I would do even if they told me they had some symptoms. What are other people's opinion on that?
So I do ask people to let me know if there are changes on that, symptoms and contact and so on and so forth. But that's a very good point. What would I do? I'm not entirely sure. I guess is that something that we should report to someone, or do, like Don says, maybe just if they actually get tested and are tested positive? So what should we maybe have some direction on that?
If they tested positive is the scenario that you're thinking of?
Yes, we
After.
pre-screen people and we make them aware of the self-assessment tool, but then we're also asking them to let us know, because it's the exposure to our clinic that other people utilize. So if they do test positive for COVID or have symptoms, everybody's a little different, how long should we kind of extend that out to, 10 days, 14 days? Is it only if they test positive for COVID-19? Is that reasonable? Or should we say if you develop any symptoms you're concerned about, you need to phone 811 and you need to let us know?
Yeah, that's a good question. I think from the perspective of providing patient care to that individual, then it would be a matter of keeping in touch with them and figuring out what their symptoms are and them calling 811 and seeing what is recommended for sure. But I'm not sure what the guidelines state around the access to your clinic or informing other clients, that type of thing. It's a good question.
And recognizing that usually we only see these people once. We may follow up with them on the phone to finish the interview, but because it's medical legal, we may only ever see them once.
And you're doing cleaning processes in between clients, etc., disinfecting.
Yeah, we are. Yeah. The clinic is getting a thorough cleaning after every patient.
So really, you're minimizing your risk regardless. It's just that if you knew that that client was positive, you would have not had them come into your clinic, right?
Yeah, or if they were potentially asymptomatic, but do test positive following the clinic assessment.
I think I'm pretty confident that our cleaning regime is not going to place anyone else at risk, and also because of the gap between clients. So I guess to me, the risk would be more to myself.
Yeah.
Right. But should we do something, if they do get back to us and say, a week after we saw them, hey, by the way, I just tested positive for COVID. Is there something we should do other than encourage them? Well, if they tested positive, they've already contacted 811, but should we do anything to follow through?
Yeah, that's where I would go back to thinking about, did you maintain physical distancing of 6 feet? Did you use PPE? If you weren't maintaining physical distancing and so mitigating your risk of your own exposure at the time of that appointment.
Well, and just tacking on to that, I believe they've opened it up for testing for any Albertan now. So you may want to get yourself tested if you find out one of your clients tested positive.
Mm-hmm.
Yeah.
So it's really about finding out whether or not they tested positive versus whether or not they've got a change in symptoms. That really is what we should be focused on, do you guys think?
I think so, and just following up with them, doing that due diligence to figure out, did they go to get the testing done, and what were the results of that?
Mm-hmm.
Where possible. I don't know around Marianne, around documentation of that, or whether that becomes, part of their health record, or I'm not sure about that part of it, but that's, maybe something we could discuss further. Good questions.
Mm-hmm.
What obligation do we have to let people know if we test positive for COVID-19?
You as clinicians, do you mean?
Yes.
That's a good question. I'm wondering if that's a question for the people at 811 who have been in contact.
Okay.
Perhaps that's something that we can look into and get back to you on, Dawn. I think that that's good information for us to have and to know for our own clinic. I know this is, so my mom received a call from her massage therapy clinic being informed that there had been a patient attending that clinic who had COVID symptoms, and she just self-isolated after that. But that was also a month or so ago, right in the thick of things, as new information was coming out. So just something to throw out there as a thought, but certainly I do think that it's helpful for us to have some clear messaging around that. So Robin Tulaski, maybe that's something that we can connect with 811 with and confirm for sure.
Yeah, thanks, Robin. I think we could follow up and get back to people on that topic. It's very good questions.
And that's one.
Marianne.
Sorry. I was just going to say that's one that ACOT can follow up on as well.
Thank you. That's great. Marianne, I know you just sent out some information with regards to PPE. and accessing the government supply. Could you maybe give some quick info about that?
Yeah, so it is available from the government ordering until June 30th. So, and as of May 25th, they started charging market rate for PPE ordered through the government portal. So prior to that, they were providing it for free. After May 25th, they announced publicly that they would be charging market rate for that. And then after June 30th, so as of July 1st, all private practice practitioners will need to find their own sources and suppliers of PPE.
Thank you. And just a question for the group, because I know Chris and Dawn, for example, have ordered PPE through SAOT. We packaged things up in a bit of a kit so that it was manageable on our side in terms of filling orders. But I wouldn't mind some feedback on that kit as to what might be missing, what you'd like to see more of, less of, because we could change it up. The orders have slowed down significantly. However, I would expect after June 30th, we could get another whack of orders coming from private practice, so I'd like some feedback on that.
Christine, no, not at all. I think you're unmuted now.
Thank you. I felt so disabled there for a moment. I just was just wondering if anyone else has ordered through that government program and if they've gotten any response. I did, right after you sent out that email, I was just trying to get Lysol wipes and gowns, and I keep going to check on it every day, and it just says your order has been submitted. So I wonder how long are we expect this to take?
Yeah, it's Robin here. I also placed an order on behalf of SAOT for private practice, and I'm not sure if anything will come of that, but I've had the same experience as well. I've received nothing, I've heard nothing, and there's just no updates.
Okay, all right. Well, I just wanted to make sure that maybe if I didn't do something wrong. So, yeah, I'm okay for everything else, but I just thought it'd be a good idea to have a couple of gowns on hand, and of course, Lysol wipes we use them all the time in the clinic anyway, but we're down to our last container, so.
Dawn has ordered, but she can't unmute either.
Hey, thank you. So both myself and Karen Kirker have put through the AHS and the Alberta government, and we have received our orders, but we both only ordered surgical masks. And so that came in a box of 50. And they're fine, they're perfect. And so I think it's just a matter of what is available and the supply that they have on hand. But once you get a notice, you will get an email telling you it's on its way.
How long did it take you to get that email?
So Rabina was one of the first people she jumped right on it. When we originally sent that out, when Marianne and I originally sent out some messaging on that. So I would say within 3 weeks. I heard from it within 2 to 3 weeks, and I got it immediately. And Karen was about a week after me. So
thank you.
Yeah. So Robin, feedback on the kits that you guys did. Yeah, very helpful for me. Of course, the big thing was not having a surgical mask, but I've got those now. I essentially took to checking Healthcare Solutions every single day, and they finally showed up. Surgical masks there as well. Gloves, they've been very good about the laser thermometer. So Healthcare Solutions, and they've been great. I get stuff the next day from them. And I'm in Calgary and they're in Edmonton. So that's been very helpful. I know the kits from SAOT came from them. So hats off to that company. They've really stepped up. I think everything was good. But Robin, I tried to find the kits today on the SAOT website, and they are not, once you log in, they're not easy to find. So maybe link
Right. And the reason, just the rationale for that, the kits are only available to paid SAOT members. And so I'm happy to send out the link. The link will also be included in the e-bulletin coming out tomorrow.
Yeah.
But no, the link is not publicly available.
Right. Yes. Yeah. So I think just even when I logged in though today, I still, because I was checking to see if you guys had any left, and I just couldn't find it on the website anywhere once I was logged in. So.
Okay. We can definitely look at including the link somehow for paid members. It's just a fair bit trickier. So I will look into that for sure. And I'll send out the link again to you personally. And there's a couple of other people interested as well, so I'll make sure to get that information out.
Yeah, they've been great, and thank you so much for doing that once again. It was great.
Yes, thanks, Robin. They have been really good. We've been using them regularly. I think we probably didn't need as many face shields because they can be reused, but otherwise, yeah, they're good. And we had, if anybody needs booties, we ordered them a long time ago and accidentally ordered way more than we needed. So if anyone we need some, I can send you some. But yeah, so I think the only thing I would like to get a hold of, just a few gowns for, like I said, for home visits. It's probably not a bad idea, and I haven't been able to source those anywhere yet.
It's Carmen. I just was looking up a little bit of information in the background here, so I could provide maybe a bit more information about what happens if a client tests positive. So the AHS process following a confirmed case of COVID-19 through lab testing. So if that individual does test positive, AHS's public health department contacts the confirmed individual and provides them with direction to self-isolate. And then public health also works with that individual to do contact tracing. So they will then determine who that person has been in contact with since their symptoms started, and AHS will then directly contact any individual considered exposed to confirmed cases. So they make that determination. And so I believe you as a private healthcare provider would be contacted by public health if you are considered exposed, especially I think as a healthcare worker, if that client indicated they had been to a clinic for an assessment or an appointment, they would likely determine whether they need to contact you or not. So they say this is called contact tracing and is done in response to each case of COVID that they confirm by lab testing. Only those individuals contacted directly by AHS are considered exposed to any case. If you are not contacted directly by AHS, you are not considered exposed.
Thanks for looking that up, Carmen.
So we have a question from Joanna. Kids can't keep face masks on their face, which is so true. And I know teachers are going to have that challenge when kids go back to school. Do the kids and their parents and the aides have to wear face masks without gloves, without face, can't read the last word, Joanna. Oh, without face shields.
Yeah. Joanna, could you give us a bit more context? Sorry. Oh, yeah, absolutely. So it's difficult to keep 2 meter distancing when you're working with the kids. Marianne, I noticed that your thing is lighting up on my screen. Did you have a comment on that?
Oh no, my monitor must have just picked up that I was writing. I must have a sensitive microphone.
Mhm. So, Joanna, just as far as an inpatient setting, um, for myself, the expectation for staff is that we are wearing masks. The children might not be able to necessarily. With kids that are able to, then we get them to wear them, but otherwise, we do our best to keep the 2 meter distance and also make sure that we're wearing our PPE. I can't speak to what the expectations for age might be. Um, Joanna, I think we've unmuted you now.
Oh, okay. Yeah, no, I was just saying that that's very good clarification about what would happen on the patient's end of things. I guess whether or not there's any concern, and ACOT can probably speak to that, about us asking patients to let us know if they test positive for COVID-19.
Sorry,
Annette
everyone. I'm not
Bosworth.
sure what the technical issues is tonight. I apologize. I've just unmuted everyone's line.
So Joanna, if you want to try talking now, we'll see if we can hear you. Or not. Or we can keep using the chat box as well. And Dawn, just getting back to your comment about looking forward to finding out what our responsibility is, we'll still look into the 811 process as well if they've got any feedback. Alana, I know you were
Robin,
having some time. Oh, go ahead, Robin.
sorry. I was just going to change the topic a little bit. I just wanted to do a shout out for the Professional Affairs Committee. They are forming a task force for private practice of people who may have the time or interest in digging into third-party payer issues. So if you have time that you might be able to commit, and you could be part of this task force, we're trying to get a meeting together later this month.
Actually, Rob and I have been meaning to actually sign up for that, so that was very well timed. You can put me down for willing and able. It's Christine
Thank
White.
you, Christine.
Do I need to send in an email as well, or do you know who I am?
Oh, I know who you are.
I figured.
Thank you.
Okay.
Thank you, Dawn.
Oh, yay, Dawn.
everybody can still hear me, are there any remaining questions or comments to share this evening, or should we wrap up? It's just before 10 to 8.
This is Dawn. I don't have any more. I think that was really good. I know there's going to be more to come, though. So maybe in another month.
So, Dawn, are you requesting or suggesting maybe another call in a month? Would that be helpful?
Yeah, we should maybe look at interest. I know it's going to be July. We're already dealing with June slowing down. Yeah, we could maybe check into it.
Carmen has just shared a link to more information about if you have a positive test result in the chat box for anybody that's interested. Carmen for that.
Thank you. If anybody who is on the call tonight didn't get a chance to listen to the first call we had with private practice, you can go onto the SAOT website under the COVID-19 webpage, and there are recordings of all of the calls we've held in April, May, and now in June.
All right, so if there's no more questions, I think what we'll do is just say our goodbye. Thank Robin for organizing everything again. And Dawn, I agree, I think it would be nice to just do a second, but we'll see what interest levels are at next, maybe in another few weeks.
That sounds good. Thank you very much, everybody.
All right. Thanks again, Marianne and Carmen, for joining tonight.
Glad to be here. Thanks.
Same here. Thank you, everyone.
Thanks, everybody.
Have a lovely night.
Okay, good night.